Intrauterine devices. An intrauterine devices, it is a form of birth control, a small plastic device that is inserted into the vagina, T-shaped and about an inch long. It has strings that hangs through your cervix to the vagina. So how an IUD is inserted? An IUD must be fitted by a healthcare provider who first perform a pap test and pelvic examination. It is to test for disease like chlamydia or gonorrhea. A pap test, it is a procedure where speculum is inserted into the vagina to widen it. Then a brush is inserted into the vagina to collect cells from the cervix. The cells are checked under microscope for signs of disease like cervical cancer. A pelvic examination, it is a procedure where the doctor will insert two lubricated, gloved fingers into the vagina with one hand, while the other hand presses gently on the outside of your lower abdomen. Next is the insertion of IUD. The device is inserted in collapsed position, then enlarged to its final shape in the uterus when the inserter is withdrawn. It is properly fitted. The woman will feel sharp cramp as device pass through the internal cervical opening. She will not feel IUD after it is in place. Can woman use a tampon if having an IUD? According to Weed and Troughton, women may use or may continue use tampons or menstrual cup for menstrual flow with no danger of dislodging. There are two common types of IUD are approved for use in the US. First is the copper T38. The brand name is the Paragard, and the next one is the Mirena IUD. The copper T380 or the Paragard, the brand name, it is non-hormonal IUD. It is T-shaped plastic device wound with copper. It is effective for 10 years, after which time it should be removed and replaced with a new IUD. The Mirena IUD, it is hormonal IUD, a drug reservoir or progesterone. The progesterone in the drug reservoir gradually diffuses into the uterus through the plastic. It is effective for 5 years, possibly as long as, or it may 7 years. Side effects and contraindications. A woman may notice some spotting or uterine cramping the first 2 or 3 weeks after IUD insertion. As long as this is present, she should use an additional form of contraception such as spermicides. Ibuprofen, a prostaglandin inhibitor, is helpful in relieving the pain. In such instances, she is likely to expel the device spontaneously. It is contraindicated for a woman whose uterus is distorted in shape. The device might perforate the uterine wall. The effect of IUD on pregnancy. If a woman with an IUD in place suspects she is pregnant, she should alert her primary healthcare provider. The woman will receive an early sonogram to document placement of the IUD and rule out of ectopic pregnancy.
Intrauterine device and adolescents. IUDs or intrauterine are not often prescribed for every young adolescent because such teenager may not yet have a uterus large enough for a safe insertion. Intrauterine device or IUD and perimenopausal women who are premenopausal are overall good candidates for IUDs. Because IUDs are becoming more and more popular with the good reason. They are effective. They don't require women to remember anything. They are very convenient and also have important non-contraceptive benefits which are particularly for perimenopausal women. The progesterone IUDs will use essential and few exceptions. For instance, women with abnormal shaped uterine cavities, but the great majority of premenopausal women, regardless medical comorbidities, for instance, are appropriate candidates for the hormone-releasing IUDs, which help women to have a heavy flow. Intrauterine device and postpartum women. The insertion of the intrauterine device or IUDs after childbirth is simply and easy to undertake if the correct procedure is followed carefully. Although postpartum insertion of an IUD is usually done at 6 weeks postpartum checkup, but it can be done immediately after childbirth, and also it can be done immediately after a spontaneous or induced abortion or at the time of a cesarean birth, according to the Levy-Cantillo ACE 2012. An IUDs or intrauterine device inserted immediately this way does not affect uterine involutional. The uterus return to in pre-pregnant uterine size, and also yet another time of the insertion is after unprotected sex as postcoital protection. The best time of PPE insertion in postpartum can be undertaken up to 48 hours after delivery. However, after 48 hours is past postpartum iodine season should be avoided 4 weeks or longer postpartum. And in postpartum woman, you should check that the woman has been cancelled and given consent for a PP iodine insertion. Ensure that there are no delivery-related contraindication to PP IUD insertion. This contraindication includes any rupture of membranes lasting for more than 18 hours, any signs of chorioamnitis, and any signs of a ongoing PPH.
Surgical methods of reproductive life planning. What is surgical methods of reproductive life planning? The surgical method of reproductive life planning, often called sterilization, include tubal ligation for women and vasectomy for men. The women in the United States chosen by about 20% of childbearing age as their contraceptive of choice. Vasectomy is the contraceptive method of choice for about 11% of men. Ginagawa ito ng two procedure, the most frequently used method of contraception in the United States. This for couples older than 30 years of age. What is vasectomy? This is elective surgical procedure to the male sterilization. Ito ay permanent contraception ng mga lalaki. Ang procedure na basa diferensya na tinatawag, gina-prevent niya ang sperm para di makapasok sa urethra, thereby prevent sa kanyang fertilization of a female through sexual intercourse. In a vasectomy, may small puncture that no scalpel thickness na ginagawa sa scrotum. And then, sa vas difference naman, on flash, ginablock niya ang passageway ng spermatozoa. The vasectomy, it can be done under local anesthesia in ambulatory setting such as in primary healthcare provider, office, or reproductive life planning clinic. The man makakaranas ng small amount of pain, pero kaya naman siya i-manage dahil magiging take lang siya ng mild analgesic at pag-apply ng ice sa site. Ang procedure na ito ay may 99.5% na effective to spermatozoa in time, which represent sa vas difference sa oras ng surgery. It can remain viable as long as 6 months. Therefore, Pwede siya mag-intercourse ang lalaki within 1 week in additional birth control method. May gagamit until 2 negative sperm reports at about 6 to 10 weeks have been obtained. Lahat ng sperm sa vas deferens ay may eliminate, usually require 10 to 20 ejaculation. What is vasectomy? This is selective surgical procedure to the male sterilization. Ito ay permanent contraception ng mga lalaki. Ang procedure na basa diferensya na tinatawag, gina-prevent niya ang sperm para di makapasok sa urethra. Thereby prevent sa kanyang fertilization of a female through sexual intercourse. In a vasectomy, may small puncture that no scalpel techniques na ginagawa sa scrotum. And then sa vas deferens naman, sa on flange, ginablock niya ang passageway ng spermatozoa. Sa vasectomy, ang lalaki, itong procedure na ito, makakaranas ng small amount of pain, pero kaya naman siya i-manage sa pag-inom ng mild analgesic at pag-apply ng ice sa site. Ang procedure na ito, may 99.5% na effective to spermatozoa at time which we present sa vas deferens sa oras ng surgery can remain viable as long as 6 months. Therefore, pwede mag-intercourse ang mga lalaki within 1 week in additional birth control method ay ginagamit until 2 negative sperm reports at about 6 to 10 weeks have been obtained. Lahat ng sperm sa vas deferens ay may eliminate, usually required 10 to 20. Then, ejaculation na siya.
Tubal ligation, also known as having your tubes tied or tubal sterilization, is a type of permanent birth control during tubal ligation. The fallopian tubes are cut, tied, or blocked to permanently prevent pregnancy. Tubal ligation prevents an egg from traveling from the ovaries through the fallopian tubes and blocks sperm from traveling up the fallopian tubes to the egg. The procedure does not affect your menstrual cycle. Ang tubal ligation daw ay kilala bilang pagtatali ng iyong tubo. At ito ay isang uri ng permanenteng pagkukontrol sa panganganak. Sa tubal ligation, ang mga fallopian tubes ay pinuputol, tinatali o hinaharangan upang maiwasan ang pagbubuntis. Side effect and contraindication. If tubal ligation surgery is done by laparoscopy, an umbilical hernia or ureter or bowel perforation are possible complications. Extensive obesity might require a full laparotomy to allow adequate visualization. A number of women develop vaginal spotting, intermittent vaginal bleeding, and even severe lower abdominal cramping after tubal ligation. You might have a rapid decline in the hormones, estrogen, and progesterone. Whether this may occur is often debated, but it is referred to as post-tubal ligation syndrome. Kung ang operasyon ng tubal ligation ay ginagawa sa pamamagitan ng laparoscopy, isang umbilical hernia o ureter o pagbubutas ng bituka. Ang ilang mga kababaihan ay nagkakaroon ng vaginal spotting, paulit-ulit na pagdurugo ng vagina. Effect of pregnancy. Both vasectomy and tubal ligation are nearly 100% effective. Pregnancy rarely occurs if there is no effect on fetus. If sperm were present in a woman's fallopian tube prior to ligation, an ovum could be fertilized in the blocked road causing an ectopic pregnancy. For vasectomy, this method blocks sperm from moving into your stomach. Many couples choose it because it works. Vasectomies have a 99% success rate in preventing pregnancy. It's also simple and safe. You can do it in a doctor's office, and it only takes 15 to 30 minutes. The risks like infection and bleeding are low. In tubal ligation, in this procedure, a surgeon closes off your
Surgical
fallopian
methods
tubes,
and effect on
which
sexual
carry eggs
enjoyment.
from your
Both
ovaries
tubal ligations
to
and
your uterus.
vasectomy may
When it
lead to
works,
increased sexual enjoyment
and it's safe.
because they largely
But there are
eliminate the
some
possibility of
like
pregnancy.
bleeding infection,
However, if either
damage
partner
to
changes
the
his
other
or her
organs,
mind
side
about
effects
having
from
children, the
anesthesia,
surgery
and
may become an
ectopic
issue
pregnancy.
between them that interferes not only with sexual enjoyment but also with their entire relationship. So, we all know that tubal ligation prevents pregnancy, so you no longer need any type of birth control. However, it does not protect against sexually transmitted infections like HIV and AIDS. But if a couple changes their mind and wants to have a child, it will be a big problem because the ligation like vasectomy and tubal ligation is permanent. Surgical methods and the adolescents. As a rule, counsel adolescents to use more temporary forms of birth control because their future goals may change so drastically that what they think they want at age 16 or 18 years may not be what they desire at age 30 years. In today's generation, we know that many young people have children early at the age of 18 or maybe 18 or less. The temporary methods to prevent early pregnancy is using condoms, oral pills, and implants for the women. If the men undergo vasectomy, the testes still make a sperm, but the sperm die and absorbed by the body. And a man who has had a vasectomy still makes semen and is able to ejaculate. And if they still fail, a vasectomy or tubal ligation is the method of reproductive life planning for them, the option will still be available. Surgical methods and the perimenopausal woman. When a woman realizes childbearing for her is complete, a vasectomy for her partner or tubal ligation for her are the two most frequently requested forms of contraception as they require no further expense or motivation for success. As a couple, they have a choice whether they want to have children or not. They can undergo a vasectomy for men and a tubal ligation for women because this is one of the choices if they want to do family planning. Surgical methods in the postpartum women. Tubal ligation can be done as soon as 4 to 6 hours after the birth of a baby or after an elective termination of a pregnancy, although it may be more common at 12 to 24 hours after birth. Tubal ligation usually happens when a woman has given birth. The abdominal distension at this time may make locating the tubes difficult, so a mini laparotomy may be used. A laparotomy is a surgical incision sa ating abdominal cavity. It is done to permanently prevent a woman from becoming pregnant.